Everyone right to go? Thanks very much for joining us today. There are 76 cases, all locally acquired across Victoria. 45 of those are linked to known outbreaks, with 31 of those cases under investigation by our public health team. We'll provide you with as much information as we can in the show release later today. 36 of today's cases were in isolation for the entirety of their infectious period. That means we now have a total of some 841 active cases, 836 locally acquired and 5 overseas acquired. On vaccines, some 32,162 vaccines were administered yesterday in our state clinics. That is an 8% increase on the same day the week before, so I thank each and every one of those people for making an appointment and for turning up and getting their shot. That's never been more important than driving up those first and second dose vaccine rates, and I'll come back to what vaccination coverage means for all of us in just a moment. This weekend just passed, we saw a 20% increase in the number of people getting the jab. So there's a lot written and a lot said about people being hesitant. That's not our experience. I think many people are very keen to get vaccinated as quickly as possible, and I'm deeply grateful to each and every one of them, and of course to the teams of people in our state clinics, in our pharmacies and in our GP practices who are all working very hard to get that job done. Our state clinics remain some of the most successful anywhere in the country per capita, and just in terms of the sheer volume of work that we're doing, it's making all the difference, and we'll continue to open more of them, to look at new and innovative ways of getting vaccines into people's arms, and there literally are millions of people that have come through our system, and we know that as more vaccines become available throughout September, October and November, we will reach those national plan targets of 70 and 80%, and that'll be very meaningful to the way we live our lives. Can I just report to you that there are 52 people in hospital, 16 are in intensive care, and 15 of those 16 are on a ventilator. Just so that no one's in any doubt about the fact that this is an outbreak and is moving to become a pandemic of the unvaccinated, there are very few people in hospital that have been either first dosed or fully vaccinated. Very few indeed, and that's not just an experience here, but I think Sydney is reporting that phenomenon also. The other thing to note as well is that this virus is going to the unvaccinated. That is to say, it is finding younger people who are not yet vaccinated, and it is making many of them very unwell. The 15 people that are on ventilators in our Victorian hospitals are aged between 38 and 72. We analysed yesterday the ages of people in hospital and in ICU. The median age of Victorian COVID patients in hospital is 49, not 99. Not that that makes any difference in terms of how challenging it is for someone to be sick and how we all have to work hard to care for them, but no one should be in any doubt. This is not those that are in the last chapter of their life. We are talking about people who are altogether younger than that. Median age of COVID patients in hospital in Victoria is 49 years of age. The median age of those in ICU is 48. More than half of COVID patients in hospital are under 50, and 50% of COVID patients in ICU are in their 40s. Similar trends, I'm sure, are holding up, sadly, in New South Wales. So this is affecting people of all ages, and it's making younger people quite ill because that's where the majority of the infections are. Now, that's the numbers of the day. I'll get Brett to go to the different links in those chains of transmission and the outbreak report in just a moment. And then Dr. Stephen Warrilow, who is the Director of ICU at the Austin Hospital, has joined us today to share some experiences of treating many COVID patients last year, and to hopefully bring into sharp relief and focus the challenges of having very large numbers of patients in hospital and the challenge of having significant numbers of people in intensive care. But that'll be in just a moment. Before that, can I just make a few comments about where we find ourselves right now? As a state and as a nation, we can cope with a pandemic of the unvaccinated if that unvaccinated group is quite small. That is to say, we will cope with unvaccinated people becoming infected and becoming sick when we have reached the 70 and most importantly the 80% vaccination target. Today, as I stand here now, Victoria and the nation has only 35% of people double dose covered. 35%, not 80% vaccinated, 35% vaccinated. The notion of trying to cope with a pandemic when you are open with very few rules, when so few people are vaccinated, we know what that would mean. It would mean not hundreds of cases, it would mean thousands of cases. So as I said on Sunday, and as I think Victorians know, these numbers are too high for us to open up. If we were to open up, this is the thing with Delta. You either aim for 0 or a very low number and therefore keep the numbers low, or if you try other approaches, the numbers get away from you very, very quickly. So some people have been critical about our focus on 0. Well, you either aim for 0 or very low numbers, or you finish up with many zeros. Sadly, let's not forget that the New South Wales outbreak started with just a handful of cases. They're now reporting more than 1,000 cases a day. We have to aim to keep these numbers incredibly low. If we can achieve 0, that's a terrific outcome. If we can't, then we are all the better for having tried to drive the numbers down as low as possible, because this is the key point. Delta infects so rapidly that it's not a choice between 0 or 500 cases a day. It's a choice between very low numbers of cases and thousands of cases. It's very hard to find an in-between. No country in the world has been able to do that. And I know there is some commentary about the fact that case numbers don't matter. Well, they'll matter less once we have 80% of our country vaccinated, but they matter a lot when you only have 35% of the country vaccinated. Because the doctors tell us that 10% of cases will become patients in hospital. Not all in ICU, but anybody who's in hospital with this virus is unwell. They are sick. They would prefer not to be there. There will be a percentage that finish up needing the highest level of care, and Stephen can speak to that in just a few moments. So it's not like we have easy choices and really hard ones, and we're choosing to go with the most difficult choice, the choice that's having the greatest impact. There are only difficult choices. There are only difficult options with Delta. You either aim for very low numbers, or you will in fact have very high numbers. That's the simplest way I can put it. I remind people there are more than 1,000 cases a day in Sydney, and they are locked down too. It's not like they're open, they are locked down as well. And their hospitals are under enormous stress. We wish them well. I wish if we didn't have our outbreak and the challenges we face, then we would be sending help to them. We just can't do that, because we have to be taking care of those who need us here right now, and we need to continue to work to run these cases down to the lowest possible number. Now, this is not just me talking. This is the national plan, and we will deliver the national plan. After all, we helped to write it, and that work continues. I'll be speaking with the Prime Minister later this week about elements of the national plan and how Victoria can play a role in continuing to provide that detail and to make it the best plan possible. But the central fact of the national plan is this: you can manage a pandemic of the unvaccinated when the unvaccinated is a small group. If it is a big group and you open up and ease too much, you don't have low numbers, you have very, very high numbers, and that translates to many people in hospital. If there was another way, we would of course choose that. If there were other options that were much easier, then we would choose that. I know lockdowns are bloody tough. They're incredibly difficult for families, for businesses, for all of us. But the choice is not between being open and being closed. The choice is between low numbers while we race to vaccinate, or incredibly high numbers because we haven't vaccinated enough people yet. The central fact of the national plan: small group of people unvaccinated, we can cope with that. Large group of people, like 65% of the country, no health system can cope with that. So we'll deliver the national plan, be no doubt about that. We are very pleased to have been an active part of writing it. My conversations with the Prime Minister are always productive, they are regular, and I will have another conversation with him tomorrow evening. So this is what we're going to do. The Chief Health Officer and the government will today and throughout this evening finalise a detailed plan that will include thresholds. If we can't achieve zero despite our best efforts, how many cases can we tolerate? It will need to be a low number. It cannot be in the hundreds, because it won't be in the hundreds for long. It will race and get away from us. Then, based on those thresholds and those low case numbers, we will make further announcements about things that can be eased. Those announcements will be made tomorrow. I want to stress for all Victorians, no decision has been made about what will be on that list and not on that list. So it's not like we've made a decision and I'm not sharing it. It genuinely has not been made yet. We're looking at all manner of different things that we might be able to do, but I do want to be very clear with the people of Victoria. This will not be Freedom Day. It will not be an opening up type day. It'll be modest changes that hopefully can be meaningful in people's lives. As much economic activity as is possible, but they will be very modest changes because there is no middle ground here. It's either very low numbers or very, very high numbers until we get people vaccinated. That's not today. That is over the next few months that we will get people vaccinated to the national plan numbers of 70% and 80%. So tomorrow I will stand here and we will explain to you what those thresholds are, the low number that we can cope with, the low number that we can live with, and the easing that we will be able to do over time, over coming weeks. That will hopefully provide people with as much clarity as we can provide. And I know each of you have spoken to me so many times about and asked questions, desperately wanting to know what the months ahead will hold. If I could be more certain, if I could speak with more clarity in the midst of a global pandemic, then of course I would. Some questions will be able to be answered tomorrow, some will not be. But what is certain is that if we do not stay the course on this, then we will have thousands of people getting infected and then hundreds and thousands of people finishing up in hospital. I don't want that. And I won't make decisions that make that a certainty. I just won't do it. Now, there's been a lot of discussion about mental health, a lot of discussion about the toll of lockdowns. Absolutely. Absolutely. Lockdowns and rules, this global pandemic comes at considerable cost. No one chose this. No one wants to be here. But I just want to make a point. It is not easy to be in lockdown for all of those reasons and many more. But none of us should kid ourselves that pretending that we can live with COVID when we've only got 35% of people vaccinated, none of us should pretend that that would be easier. It would be a good deal harder than the very difficult time that we are all having now. So they are the choices. And I will not make choices that guarantee that more people finish up in hospital against advice. I just won't do that. This is bloody tough. No one's pretending otherwise. Tomorrow we'll announce thresholds, low numbers that we think we can contain. We'll always push to get them as low as we possibly can. But if despite our best efforts, zero is not something that we can achieve, I'll make 2 points. It can't be much more than zero. And secondly, we are better off for having chased zero. Otherwise, it finishes up thousands of cases. We don't wish that on anyone, and we certainly don't want that here. We will be back tomorrow to talk about those thresholds and some of the careful, considered, but I do stress, modest easing that we think will be possible and safe. No decision has been yet made. We'll provide that clarity as soon as we can. And then I will be here for many more days, asking people to get tested as soon as they have symptoms, to isolate when they're asked to do so, to follow the rules, always following the rules. And I'll be asking people to book an appointment to get vaccinated, and after you book the appointment, show up and get your shot, play your part. I just want to finish by talking about vaccines for one moment. We have very proudly across our state, we have championed the AstraZeneca vaccine, and anyone who suggests otherwise is simply wrong. The Prime Minister has on numerous occasions, publicly and privately, indicated to me that the number of AZ shots that we've been able to get into arms is remarkable, is amazing, and sees us in a stronger position. Across our state, 2.6 million doses of AstraZeneca have been administered. This is as of yesterday, so these numbers will have grown slightly over the course of the last 24 hours. But as of yesterday, 1.641 million single doses and 940,000 double-dosed Victorians with AstraZeneca. It is safe, it is effective, but you just need to talk to a health professional before you make the choice that that's the vaccine for you. The best vaccine, as the Chief Health Officer tells us, is the one you can get today. Go online right now. There are literally thousands of AstraZeneca appointments available for you. Now that won't be for everybody, but it will be for large numbers. And just so no one has any sense that they're on their own or they're making a decision that's different from many others, that's 2.6 million doses of AstraZeneca have been administered in our state. Many have made an informed choice to use this vaccine and to get their double dose protection as quick as possible and to play their part in the race to 80%. I thank them for that, and I encourage everyone else to get online, book one of those appointments. When you turn up, there will be a senior person, a health professional, to talk you through and so that you can make an informed choice. And if that choice is AstraZeneca, well then you will have played your part, just like all of us that have been vaccinated have played our part towards getting to 80%. That's what the national plan relies upon, and frankly, the quicker we can get people vaccinated, the quicker we can have the freedoms and the economic activity that we all desperately crave and that we all are entitled to, but only when it's safe to do so. That's where we're at. That's what the next couple of days will look like. And of course, we'll take all your questions. But first of all, I'll just ask Brett to speak to the numbers of the day in a bit more detail. And then Dr. Stephen Warrilow from the Austin Hospital, and he's the director of the ICU, will make a few comments. And as I said, we'll then take any and all questions that you have. Chief Health Officer.
Thank you, Premier, and good morning. So of the local cases reported in the last 24 hours, I can provide the following for the 45 linked to date, understanding that a number of those cases would have come through late last night and will be linked over the course of today and tomorrow. But 17 are linked to the My Centre childcare. A number of those are day 13 tests. 9 linked to the Shepparton outbreak. They were all in quarantine, by the way. 3 are linked to Millers Junction Shopping Centre in Altona North. 1 linked to the Learning Sanctuary in Spotswood. 1 linked to the St Kilda East cluster. 1 is linked to a legal office in Melbourne's Outer East. 1 linked to Altaqua College. 1 linked to the retail warehouses in Fisherman's Bend. And 11 cases that are linked to existing cases but that have an unknown acquisition. 36 of all local cases have been in isolation for the duration of their infectious period. And again, as we work through some of the remaining cases, there'll be a larger number that I think will be determined to have been in isolation for that entire infectious period. In terms of the locations, look, there are a number of local government areas. The primary ones, 9 in Greater Shepparton that I've spoken of, 7 in Hobson's Bay, 24 in Hume. Again, the My Centre childcare outbreak will represent a number of those. 8 in Moreland, 10 in Wyndham. But they are really across metropolitan Melbourne, includes 1 in the Mornington Peninsula, 3 in Melton. There's a big spread. In terms of the age of active cases, just to update on yesterday's numbers, 182 are 0 to 9 years of age, 125 are 10 to 19 years of age, 177 20 to 29 years of age, and 158 30 to 39 years of age. And look, it's more than just a number. As you heard from Kylie, the critical care nurse yesterday, there is a story behind each and every one of these cases, either of very significant illness, hospitalisation, ICU admission, and for some people, their lives change forever. We wish all of them well. There are some bright spots in our current outbreak. As I said yesterday, it's a very challenging situation, but The early outbreaks are maturing, and we really do have the public health response around them. Glenroy West School, the My Centre outbreak in Broadmeadows, and St Kilda, really down to those last cases, all in quarantine now. The comparatively large number of cases in quarantine today is really a good sign, and there will be more, I'm sure, identified in that category. We've also done fantastic, I think, community engagement work, community fora involving community, sports, clubs and leaders, faith leaders and local doctors. We've deployed many bicultural workers and a rapid response engagement team, especially in the western and northern suburbs, supporting the call for testing, but again, compliance, vaccination and quarantine. We've also stood up bespoke testing sites as required. The Newport Community Hub was stood up, one in the Islamic Museum of Australia, the My Centre childcare outbreak, just to respond to the location of cases. And they offer culturally appropriate and all-age testing, including, for the youngest of kids. So I'm really proud of the work across the team, from that community engagement and testing to the ongoing encouragement for vaccination and the support to those who are struggling with isolation and quarantine. We have had an exposure inside a residential aged care facility in Echuca, but we moved quickly to contain that, and day 9 testing of all of those residents and staff has come back negative. So no transmission in that aged care facility. That is good news. We've also had multiple cases in public residential towers, often pinged on wastewater detection, but those individuals by and large have moved to formal quarantine to finish their quarantine period. There's been testing on the same floor. There's been engagement with everyone who's considered a tier 1 contact, and really no significant further transmission in those public residential towers at all. That has been a fantastic response. But to the challenging areas, we have seen continued transmission. We continue to see mystery cases on a daily basis, especially in the western and northern suburbs. I know everyone in Hobsons Bay and Wyndham and surrounds are aware that COVID is present in their neighbourhoods, and the vast majority of people understand what they need to do to protect themselves and their families. But wherever you live in Victoria, and maybe particularly in these areas, and Brimbank and Hume, the consequence of letting your guard down, even for a short period of time, is really significant. It could mean the difference between you containing it to yourself and nobody else, or introducing it to those you love, your extended family, your friends. Taking it to a parent who lives in another household could be an absolute tragedy. Taking it to your friends, and people sometimes think, oh, my friends are young or my friends are vaccinated, it won't be an issue for them. But if they are infected and they transmit, sometimes before they have symptoms, to their households that contain vulnerable individuals, sometimes not yet vaccinated individuals, then those tragedies can play out. And the extent to which we can keep our guard up all of the time is the extent to which we can end these restrictions at the earliest possible time. I try and remind you every day, but it's not just my voice. That's what Kylie spoke to yesterday. I'm sure that's what our ICU director will tell you today. Dr. Mukesh Haikawal has spoken of exactly the same issue. Dr. Amura Hussain, in your community groups, the message is clear because the message is true and the message is critical. You really need to follow the rules, not just because they're rules. It is the way to protect yourself, to protect those that you love. So please put your family and your community first. COVID seeks out all of those gaps: the unvaccinated individuals, the individuals who are not doing the right thing, the individuals who get in touch with others unnecessarily, and provides an opportunity for transmission. So please act as if you're COVID positive wherever you are. That's what wearing a mask is about, and that's what minimising contact with others is all about. There are supports. Again, I remind everyone, if you go to www.coronavirus.vic.gov.au and click on financial support, those financial supports on offer are available on the homepage. The disaster payment is available if you can't work because of the restrictions in place. The test isolation payment, if you're missing work, of $450 is available, and the $1,500 isolation payment if you have to quarantine for 14 days. So if you need support, please reach out for it. As I said yesterday, if you have symptoms of any kind, and we've talked about cough and sore throat and runny nose, but headache can be prominent, aches and pains can be prominent, sometimes it's diarrhoea and abdominal pain. Any symptoms, if you feel unwell, please get tested. If you don't have symptoms, you are free to go to a vaccination hub or to your GP. And please follow the rules to protect yourself and protect all of those around you. I'll pass to Dr. Worrell.
Thanks very much. Good morning, everyone. The intensive care unit is really the last line of defence for a human being's life. We only manage the sickest of the sick. And I learned very early on in my career that actually, as an intensive care specialist, no one ever really wants to meet me or my team. You do not want to be in a position where you need our care. Because by the time a person who's critically ill needs care by my nurses, my physios, my colleagues, really your life is on the line. And we are a well-resourced team in terms of our equipment. We have great outcomes and prodigious skills, and in terms of critical illness, the outcomes that we achieve here in Australia are unparalleled around the world. But intensive care is a finite resource. And even with exquisite planning and deploying our resources, we are challenged by this pandemic. We've got a lot of patients to care for in our routine business as usual activity. We've got patients who may have complications, life-threatening complications of pregnancy. We've got patients who have to have major cancer operations to allow their survival. We have patients with heart attacks, brain hemorrhages, trauma, overwhelming pneumonia, strokes, all sorts of catastrophic illnesses that threaten their lives. And that's the world that I work in. That's the world that me and my team live in. COVID has thrown us some additional challenges, and by and large the system has responded really very well to those. But the most important thing that the community can do to allow us to do our job is to follow the directives and get vaccinated. Because whilst our system is very agile and very capable, it is also, it's possible to overwhelm us. Even with the best equipment and the best training in the world, we only have a finite number of ICU nurses, for example. These are highly trained clinicians. It takes years of dedicated training and effort to get to the elite level where you can manage all of the complex requirements of a critically ill patient. And I think there's going to be a lot that's said in due course and written about these interesting times. But I think there'll be a consensus that perhaps the true heroes of a lot of what has occurred in the last 18 months have been the ICU nurses, who go in there day in, day out, never complaining, wearing full PPE for 12-hour shifts, and not just a mask, but a full impervious gown, the face shield, the mask, often N95s when they're dealing with COVID, and they just get on with it. And in a sense, that's what all of us that do intensive care signed up for. That's part of the deal. We knew that when we started our training. But I don't think anyone knew it would be necessarily this difficult, that we'd have to deal with the challenges of a pandemic, that we risk being faced with impossible choices about who we might even admit to intensive care if we are overwhelmed. And certainly our families did not sign up for this. Our families have been dragged along for the ride, whether they wished for that to occur or not. One of the things that I think is challenging about intensive care is that because we manage only the sickest of the sick, thankfully for most people out there, it's not particularly relatable. So I thought it might be helpful to share some of the stories, and some of these are challenging, about what happens when someone becomes critically ill in the ICU, particularly with COVID. And I draw on some of the experiences of last year of patients that we looked after. And I think it's well understood that the people who are most vulnerable perhaps to critical illness with COVID perhaps tend to be the older patients and those with other medical problems. But I think it's important to emphasise that that is in no way the only patients that we've been looking after. In fact, thankfully, many of our older members of society are now immunised, and they're not getting critically ill, which is wonderful. But as we've heard, we're seeing a younger cohort of patients come through. Some of them are very unwell. sickest patient that I was involved with the care of last year was in their early 40s and previously really fit and well. And they were extremely sick. In terms of the involvement of the lungs from COVID, which is the primary challenge that we have from a critical care perspective, it's hard to convey, I suppose, but it's like drowning on dry land. You just cannot get enough oxygen. You cannot get enough air, no matter how much you try. The relentless effort to breathe is overwhelming, until the point where the patient simply can't safely maintain that anymore, and we have to put a breathing tube down into their throat. We anaesthetise them, we put them on a ventilator. And to do that to a human being is a big deal. It's hard for those patients, and we do it when there's no alternative. Then some of those patients, that's where the illness kind of becomes arrested and we can turn things around. For some patients, though, their deterioration continues, and in a sense, other body organ systems get dragged down with the critical illness, and we see patients with failing kidneys, failing hearts. The immune system itself can take a hit or become too overactive. These are incredibly complicated challenges to manage, and these patients aren't turned around in a hurry. For our stock standard ICU patients, it's very common for them to stay maybe a couple of days. We can turn things around and get them out pretty quickly. With COVID, almost invariably, these patients have a long stay. So the number of intensive care bed days that they occupy is considerably more than our business as usual case mix. So it's not just the absolute numbers of people that become critically ill and need our care, otherwise they might die, but the length of time they need to spend with us whilst they recover to the point where they're safe enough to be discharged to the ward has a huge impact on our ability to care for all of the other patients. Another important concept is that of displacement. We will always provide critical care support to Victorians that need it. We've got your back, but it means that we have to make certain choices. If we are overwhelmed with demand by COVID patients, that necessarily impacts on our ability to care for other patients. That includes patients who might need major elective heart surgery, for example, or major semi-elective cancer surgery. So someone is going to feel the impact of that ICU bed being a precious resource. And our system is finely tuned to, generally speaking, have a really good match between society's demand and our ability to deliver. But that neatly balanced paradigm can be overwhelmed in the setting of a massive pandemic. And so, just as the community did a great job of last year, from the intensive care community, we're really asking people to do whatever it takes to get your vaccine. I think, as we've heard today, the right vaccine is the one that you can get. Make the decision with support of your GP if necessary, and get yourself immunised, because that's the way that you can ensure that we have the least impact on intensive care. As we've already heard, essentially critical illness is almost unknown amongst the fully vaccinated. If you are fully vaccinated, you may still be unlucky enough to get COVID, but you're not going to become critically ill. You're not going to die, and you're not going to need intensive care support, and that means that we've got availability for the unvaccinated population. So severe COVID disease, such as requires intensive care admission, is pretty much a disease of the unvaccinated. That's clearly what's coming out through information that we now see from overseas, and that's increasing our lived experience in Victoria, and as we've seen with our colleagues in New South Wales. An important thing to touch on, and I'm often asked this, is how is the team? And the intensive care community is a tight-knit team. The doctors, the nurses, our physios, our support staff, our techs, our lab assistants work very closely together and provide a lot of mutual support to one another. But the team is tired. This has been relentless. Like all of you, we've not had the opportunity to spend time with our loved ones in the way we ordinarily would, to not have holidays, to not have time away. So people are tired. They're incredibly resilient, and their dedication is humbling. But there's a finite amount of time that people can keep this up. And we really then implore the community to try and help us out by protecting us. We want to maintain our normal high standards of care. And my colleagues at the streaming hospitals such as the Northern, Box Hill, the Alfred and the Royal Melbourne are doing a superb job of maintaining the excellent standards of care that we know deliver great outcomes that are globally incredibly recognised as being incredibly good. What we don't want to do is get overwhelmed with an influx of admissions requiring intensive care support, that we have to change our model of care to something that isn't the gold standard that we try and deliver every single day. We would only obviously do that if we get huge numbers, and we've got plans as to how we would do it and how to do it as safely as we possibly can. But those are decisions that I don't want my team to have to make, because I think every Victorian should reasonably expect that the level of care that they get will be world-class under all circumstances. And as I keep saying, we're very keen for the community to support us by getting immunised, follow hand hygiene rules, socially distance, stay at home, do all the things that have been the mantra for the last 18 months and will keep us safe. Thank you for your support. Without the community support, we wouldn't be able to do our job. Thank you to our families, and especially thank you to the bedside clinical teams that are making all of this wonderful work possible. Thank you.
Thanks very much. We're happy to take any and all questions you have.
Can you explain what the plan...
And we'll answer all of them as we always do. So,
can you explain what the plan will look like in a little bit more detail? What it will involve as far as...
Look, yeah, Chanel, it's an absolutely legitimate question, and if I could make all of tomorrow's announcements today because the decisions were made last night when they're going to be made tonight, I absolutely would do that. And I think people would credit me with having been quick to announce when decisions have been made, and I don't want to be speculating to the point where you're just making things up. I don't have advice from the Chief Health Officer, so you can ask him the same question and he'll give you the same answer. We haven't sat down and had the meeting. It'll be a lengthy meeting. It'll be lots of phone calls back and forth, lots of poring over data, trying to work out is there a sweet spot? Is there that case number that is not 0, but it's not so high that it inevitably becomes 500, 1,000, 1,500, 5,000? That's what's happening in some other places. We don't want that here, because as Stephen has just told us, I simply would not be doing my job if I made decisions that I knew, as a matter of certainty, would fill our hospitals. So there will be a time for us to go through all the decisions. I want to emphasise they will be modest. This is not Freedom Day tomorrow. That only comes when we have 70 and then 80% of the community through the vaccination program. And I just remind everyone, that's what the National Plan says. We are going to be compliant with the National Plan. We helped to write it. We are fully supportive of the National Plan. But the National Plan does not, and the Doherty modelling does not support us giving everybody what we all desperately want, which is that freedom to go back to normal with only 35% of people vaccinated. They didn't choose 35 or 45 or 55. They chose 70 and 80. And even then it will be challenging, because the virus will rage through the unvaccinated 20%, and there will be patients that turn up in ICU. That's why 80% is our goal. Every percentage point we can go higher than that, that'll just mean that there's just a little bit less work for our nurses and doctors to do.
Are there any schools under these restrictions?
No. No, but I'll have more to say about particularly senior cohorts tomorrow.
So it won't be whole schools, but potentially some cohorts?
No, I'm not opening schools tomorrow, but we will have more to say about schools and about what might be possible. Again, I'm not here today to make sort of half announcements. I'm being clear with people. This work's going on. I've always had a view, whether frustratingly or otherwise, I've always had the view that if we're doing the work, you and the Victorian community are entitled to know. We are doing that work. It's not finished yet, far from it. When it is, which will be later tonight, we'll be back here first thing tomorrow morning, taking you through it all.
Are there any change in mindset?
Sorry?
Are there any restrictions that you can...
Well, I think I've just indicated we're not opening schools, and let me explain why. Perfectly legitimate question from Julia, and parents want to know. They absolutely want to know. I could open schools tomorrow. I could say, well, Professor Sutton, thanks very much for your advice, but look, it's all too hard, and I'm going to go a different way. All the schools will open, but they won't be open for very long, because what will happen is we'll finish up with cases, and one by one, schools will have to close, kids will have to be sent home, deep cleaning. Some of those kids will go home with the virus, and they will give it to everyone else in their household. And that household won't be in a lockdown like we all are now. They'll be in 24/7, 14-day lockdown. Can't leave your house. Plus a number of people will get very sick from that. And then I think you'd find parents would stop sending their kids to school. They'd make a judgment, and in fact we probably would have shut them all down again by then. If I could have them open tomorrow, of course we would. Of course we would. That's not the advice, because that's not what's safe. At 35% vaccines, at the number of cases we have, at the amount of community transmission we have, there'll be a time, of course there will be, when we can safely have our schools open again. The 12 to 13, 14 and 15-year-old vaccination approvals that were given last week, fantastic news. And I'll have more to say tomorrow about how we're going to get our kids vaccinated, particularly our senior kids.
Other than the schools, though.
But so that's one example, and I hope people get from that it's not like a flippant thing that no, yes, no, like tick and flick sort of thing. Everything is considered, and if the answer is no, it's for good reason, for very, very good reason. Now, I know why you asked me to rule things in and out, because that's kind of essentially Charnel's question, what's in the plan tomorrow? I don't really necessarily want to go through every single thing and rule them in and out, because then I really am just making things up. I don't have advice yet on any of these matters, but logic tells me, and I think the advice will confirm, that schools will not be opening tomorrow, but we'll have more to say about what can safely be opened and what that threshold is. If it's not zero, is there a number of cases out in the community, not the gross number, but the net number of people who are out there while they're in their infectious period? What is that number that we can safely ease at the margins at first and then maybe go further? But I just want to emphasise, this will be conservative, because once it starts running, you just can't pull it up. Back to the point I've made, with no sense of anything other than sadness. Sydney's locked down, and still they've got these massive case numbers every single day. That just shows you, once it's gone, there's no pulling it back.
Do you think a phased plan for several weeks ahead, or are we looking at another 2-week block?
We will have more to say tomorrow about the duration, but I think, again, I would hope people would just reflect on the journey. Wherever we've been able to talk about multiple weeks we have, whenever we've been able to give people a sense of, well, here are different points in a roadmap, different points in a plan, we've always tried to do that. And invariably, because of the great work of Victorians, we've been able to hit those marks. We've been able to do as we had planned. Again, tomorrow is the day for us to take people through that. It will not be everything, and not every question will be able to be answered, because there are some things about this Delta strain that we don't know. One of the things we do know, though, is it's either aim and deliver a very low number of cases, or suffer the consequences of a very high number of cases. And that's when 10% of those cases finish up in hospital. Some of them finish up very, very unwell. And that's when Stephen and his team come under enormous pressure. Enormous pressure. And I always had a very high respect and regard for all of our medical and nursing and healthcare workforce. I've had the honour and privilege of working closely with many of them over my time in public life. But I'd never been a patient. I was earlier this year, and when Stephen speaks about the challenging nature of intensive care, I know a little bit about that. And I would never want to do anything, and I never will do anything, that will make the job of people like Stephen harder. I just won't.
Is this to be clear though on the plan? Sorry to ask again, but will it be a situation where it's, if cases are at this much and if vaccination is at this much, then we can move to this step? Is that what the plan will look
Essentially,
like?
that's what I'll outline tomorrow, yes. If we can keep cases to a number, here are the things we can ease over a period of time as we all race to get vaccinated and get the numbers up to 70 and 80.
As long as vaccination's at a certain point.
Yeah. Although, to be honest, I'm less... sorry, I just want to be careful here.
Yeah.
It's not about us coming up with some new Doherty thresholds at 40 and 50 and 60, right? They remain, because if we did that, that would be being unfaithful to the national plan. 70 and 80 have been chosen for a reason. They make it a fair fight, if you like. We've got every prospect of being able to cope as a health system with the disease that will happen. Back to my almost first point. A pandemic of the unvaccinated, when that group is small, won't be easy, but we can get that job done. A pandemic of the unvaccinated, when that's the vast majority of Australians, you just can't do it.
So it won't be a plan heading towards 70 purely based on where we can keep the numbers. If we keep them at that point, then this is where we move along.
Basically, yes. If we can achieve certain numbers, then we can open up in certain ways. We can ease is probably a better way than opening up. Gives people probably an impression that's a little more adventurous than what we can do. And what I'd say is this will be the first instalment. If we can add things to this along the way, then we will. We've been working on this for quite some time. And I just say again, people are free to have views, and there's lots of thoughts on zero and all those sorts of things. If you don't chase zero, you finish up with many zeros. Thousands of cases. That's the absolute fact of this.
Premier, is that cases or is that people infectious in the community?
Oh, I think the most, as I've said many, many times, I don't want 100 cases a day because that's a lot of people who will get sick. But there is a difference between a case number and the story and the narrative that sits behind that case number. So if we think about it in terms of gross and net terms, there might be 100 cases, but if 60 of them, or 70 or 80, were at home, they were in ISO, they were making those sacrifices for the rest of us and they're no risk to public health, then they still count for the purposes of treating them and taking care of them, but they don't count in a risk rating way in terms of trying to make assessments. So it'll be focused very much, as it should be, on the numbers of people out in the community that we can cope with. Noting, just again, people may have, because we're all sick of this well and truly, and we're all tired of it, but I just again remind everyone, the thing with Delta is by the time you go and get tested, we get notified of the positive result. By the time we get to you and we're getting to people in record time, I can't tell you how proud I am of our contact tracers and the work they're doing at the moment. But by the time we get to you, chances are you've already infected all the people you live with. And we've moved beyond you then, we've moved on to your contacts and your contacts' contacts. It's incredibly fast, and trying to contact trace in that way without rules that limit movement becomes impossible at relatively low case numbers. As I said before, it's either, whether you can get to zero, that's, you're better off for aiming for it. To aim for zero means you'll achieve low numbers. That's why I don't agree with this notion that case numbers don't matter. They'll matter less when we get to 80%, but at 35% they matter a lot, because 1 in 10 of them finish up in hospital.
In today's numbers, Premier, is what comes first, the sweet spot or that low number that you're going for as zero, or 80% vaccinations in December?
No, what I'm going to talk about tomorrow is a number of cases, a number of cases in the community that we can tolerate and we can trace and keep a lid on while we vaccinate. That case tolerance will not be the relevant factor once we get to 80%. The national plan absolutely kicks in from then, and we will be much less focused on case numbers. We'll be much more focused on treating those that need to be treated and as this is the living with COVID thing, encouraging the 81st, 82nd, 83rd, 84th percentile, there's extra people to go and get vaccinated at that point, because every single person who gets vaccinated is one less candidate for either serious illness themselves or one less person that can contribute to a chain of transmission that ultimately ends up with somebody in Stephen's intensive care unit.
Vaccine passports. Do you have any modelling though on, say, if everybody followed all the rules as we've been asked to do from today, on today's numbers, how long will it take to get to that sweet number, as you say, or that zero cases?
I'll have a bit more to say about modelling tomorrow. Whether you have a specific piece of modelling that models exactly that question, or whether you've got other modelling that we have done in the background almost every week, you can sometimes get the same answer to that question and be confident that the assumptions you've made and the range of cases that you think you can live with, it'll have to be a low number. And we're not talking about hundreds of people. If you have hundreds of people in the community with this, exposed to other people, then you won't have hundreds for long. It becomes thousands really fast. That's the dilemma we're in. That's the incredibly challenging phase that we're in right now.
What if we don't get to that number?
Well, we are at a number we have, for instance, if you just look at the numbers today, they're not zero, but the majority of cases are not a risk to public health. So there are bands, there are thresholds. We will have an achievable number because that's what the real world is about.
What about
vaccine? So it's quite ironic, really, that while we're being criticised for some sort of ideological mission to get zero, that's not what we're doing at all. A zero strategy means that you can deliver low numbers, and if you don't deliver low numbers, there's no intermediate number. There's no kind of, oh well, we didn't do so well, but we'll keep it at 500 a day. No one has done that, and I don't think anybody will.
What happens if it starts growing? So if we get to a figure, say 10 infectious in the community on any given day, that's the point when we ease a certain restriction. What happens if we then get that number going up?
Well, again, you'd always have to look at the conditions at the time. You'd always have to have a look at what was happening and what the story behind those numbers was, and whether it was it sounds odd to say this, but there are some outbreaks that are much more challenging and much higher risk than others. Just like there are some COVID patients who are a much greater risk to public health than others. It depends what you've done, who you've been with, all of those sorts of things. Did you get tested within hours of feeling that scratchy throat, or did you wait a week? All of those things become relevant. So that's when I talk about narrative and the story behind case numbers. It really is very, very important. Let's get the framework announced first before we start necessarily trying to explain to you all what will happen if it doesn't work. I'm confident it will, because we're going to do conservative things, modest things. It's not Freedom Day tomorrow. Our freedoms will come, and they'll be guaranteed as best you can in a global pandemic once we get to 80%.
What about vaccine passports? I mean,
yes.
Singapore's got them, Greece, Denmark. Denmark is giving those that are double vaxxed more freedom than those that aren't vaxxed.
Sure.
Are you considering something like that?
Yeah, sure. There's a couple of points there. I get asked a bit about will you be mandating a whole lot of different workers? I think if you look at it and say more likely, less likely, yes, I think we probably will. And we'll probably start in that health space. But again, we want to do that respectfully. We want to talk to unions, talk to workers, talk to the people that Stephen has just been talking about. Thankfully, the take-up of vaccine is very high, but it's that last push to make sure we get as many people as possible. We may well have to mandate in some areas. We've already mandated in aged care. Comes into effect later on I think the 17th of September. In terms of passports, though, so the second one I get asked a lot about is, well, what about once we get to 70 and 80? How will life be different for someone who's vaccinated and someone who isn't? Now, I don't think it's appropriate to talk about locking people down who aren't vaccinated. Like, how would you enforce that? That becomes incredibly difficult, right? What I think it's going to be is you will have greater freedoms. You will have greater freedoms, just like we've already seen. Qantas, Virgin. I'll make a bold prediction. You won't be getting a visa to too many countries if you haven't been double dosed. And they'll have a list of vaccines that they're prepared to accept.
Well, in Denmark, you don't go to a venue or in
Yeah, I'm coming to that. And then I think it'll extend all the way through, not just to getting on a plane, but I expect it will extend to booking a restaurant, booking a seat at the footy, the cricket, going to the theatre, doing all sorts of things. We have no jab, no play in our childcare centres now because it works. And anyone who's affronted by that, anyone who's got a massive problem about that, public health and the decisions we have to make are all about the greatest good for the greatest number, and always trying to drive that number up. So I won't be happy with 80%. We'll deliver the plan. We'll be essentially open by then. That's what everyone's aiming for. But I'll be still pushing to get 81 and 82 and 8, as many as we possibly can, because everybody who's vaccinated is one less link in a chain of transmission, and one less person who can potentially finish up very, very ill.
Is the new plan essentially an acknowledgement that we're almost certainly going to be in some form of lockdown until we reach those Doherty goals?
No, I think that there's never been any pretending. Rachel, if you've got cases and you've got community transmission with Delta, there's going to have to be rules. Whether it's termed a lockdown, a lock-in, a whatever, stay at home, whatever you want to call it. The notion of having very few rules and Delta moving around the community, again, I stress, with 35% of people vaccinated, no one supports that. No one should, because what it will mean is that we just have thousands of cases. So it is an acknowledgement that Delta is a very challenging enemy. But we've done this before. We've done it before, and I'm confident we can find that middle path where we have not necessarily zero, but low numbers, and we keep doing everything we possibly can to make them as low as possible and keep them low. Otherwise, they get away from you really fast, and ease up in some areas. But I have to stress, it's not going to be wholesale changes. It can't be, because then we'll just be promoting the spread of the virus where we don't have enough people vaccinated. We can't act like we're at 80% when we're at 35. Perhaps that's the easiest way to put it.
How likely is it that regional Victoria will have different rules from metropolitan Melbourne?
Well, can I just give a shout out to the people of Shepparton? I know there's a bit of commentary today about will we be ready for the day 13 test. We're doing everything we can to be ready for the day 13 test, but I just say to the people of the Golden Valley, there's a lot of you that will need a day 13 test. So it's going to take a bit of time to work that through, and it's a proper clearance process. It's not a tick and flick, it's a proper process. Because we saw, for instance, with some Altaqua families and others, when we got to day 13 testing, we actually had positives. So the Shepparton community have done a great job. All the country of Victoria is hurting though. This is really tough. But getting around the Shepparton outbreak as we have, looking at wastewater, looking at all of everything that's on the board, there's not a lot of virus out there known to us. So I think we may well have options to do more, go further, or maybe faster in regional Victoria. But again, it's all got to be balanced because you only get one chance to make these decisions. If it runs, I think we all understand this. At least I hope we do. This thing is incredibly hard to pull up, as they're sadly having to deal with up in New South Wales.
The New South Wales Premier wants all states to open up to return travellers once we hit 80%. Is that something we're looking at doing?
Returning from where?
Oh, overseas to get all Australians home by Christmas.
Oh, with the greatest of respect to the New South Wales Premier, they're matters for the federal government, and I wouldn't have. That's not the top of my list. If, like, we will do everything we can to safely quarantine in whatever that quarantine looks like, and it may be home-based quarantine, it may be electronic quarantine. Premier Marshall and the South Australian Government, on behalf of all of us, are doing some pilot work around home-based options. I can see a situation where, we get to 80%, sort of toward the end of the year or into the early next year, say, just pick a date, so in January 2022, I can see somebody who's double dose vaccinated coming back from another country, and they don't have to go into hotel quarantine. They might be able to go home. They might have to answer a phone call a couple of times a day with some facial recognition technology and stuff to establish that they are in fact at home, and they might only have to stay home for a few days till they got a negative test. They may have to stay longer. It'll depend. None of that's finalised yet, but there's work going on to that end. So that all of that changes. And again, that's why people, when we say vaccines are our way out, it's our way out not just for those who are here now, but it makes travel possible. It makes all sorts of things possible. I had a long conversation with Jacinda Ardern last night about a whole lot of the stuff they're dealing with at the moment. They're in a very similar position to us. The cases aren't overwhelming them yet, but there's too many to open up. If you did, you would be overwhelmed. That's the absolute certainty of it, and that's the devil of this Delta strain. But we talked about all these sorts of things, bubbles and all sorts of arrangements. I think technology is going to be a big part of next year, and we should use it wherever we can.
Has he heard back from the Fed regarding
higher than
extra?
they were when you brought in the curfew and banned playgrounds. So can you just explain the change in mindset? Again, I'm not saying that those things are going to come off, those rules are going to come off.
No, I wouldn't assume that those things are coming off.
Can you explain the change in mindset from going harder 2 weeks ago to now looking at easing some modest restrictions?
Yep.
Why has that change occurred? Is it because the timeline to getting to 70 and 80 is shrinking?
Well, A, every day we get closer to 70 and 80. B, I know that as strong and as tough and as resilient as the people of Victoria are, we're all tired, right? So the notion that we can just continue to do this endlessly, I understand that there are not infinite reserves for people to draw on. We've all got limits. It's really, really difficult. So, that's when we say, whenever you ask us questions, all of you ask questions every day, right? You all ask questions sometimes, and we say everything's on the table. We're looking at everything. It's true. Every day we assess where things are at, and no one's given up on these numbers being lower. They need to be lower. Every day we have to work towards that. Because if we don't have that mindset and throw everything at this, then they don't stay low. They in fact get really, really high. And we can cope with that. And this is where I take objection with people who are out there now today saying, numbers don't matter. I'm sorry, but at 35% vaccination, they absolutely do.
They do.
At 80, less so. Much less so.
That's why I'm asking, given that we're not at 80,
Yep.
is it an acknowledgement of the mental health toll, or what is it in particular that has caused this change in mindset? No,
it is an acknowledgement of work that's been going on for a long period of time, and we're always throwing everything we could at this. And I'm not saying that period's over yet, just quietly. I'm not signalling that tomorrow is some freedom day where we get to just flip everything. That's not the way it's going to be. But we think that there may be a number that is not zero but is low that we can contain. The other thing too is that you learn from every case. You learn from every day of contact tracing. You learn from the mapping of every single outbreak. And we have been able to run Delta to ground to 0 cases in the community in the past. This is proving more stubborn. This is proving more challenging. And there's a whole range of reasons for that. And I'm not here to be bagging people, but all I'll say is that if you've got symptoms, please get tested.
So is
And the rules apply to everyone. It's not like you can say, oh well, I'll just go and do this because the rules are for someone else. No, we've all got a part to play, and we all benefit when we all play that part.
Is there a hope that by easing some restrictions modestly, that people will follow the rules more closely?
I would always hope that people were motivated by the logic of this.
But they haven't been. So that
Well, no, I think hang on. Let's be really clear about this. What I get, like, when you see some of these flagrant things, the jockeys or the engagement party or whatever it might be, right? And there are lots of other examples. You get angry, yeah. But the thing I get most angry about is that those sort of incidents take away from the sacrifices and the compliance, the good work, the rule-following behaviour that millions of Victorians have exhibited, millions, for 20 months now. That's what gets me most upset, that their contribution is diminished by the poor choices of a small number. What we are hoping to do here is, in recognition that some of these rules, they can't be on forever, and we are seeing more people vaccinated, because we've kept it low. I've said to you, how many times have I said, we will have options that others don't have. You either chase zero and deliver that or very low numbers, or you have lots of zeros at the end of your daily case numbers. That's where we're at. Thankfully, we're in the low number. We're at the low number end of that. And that does give us options. And I'll announce some of those tomorrow.
From the feds on extra vaccines or potentially boosting our vaccine supply?
No, but I think there's some discussions between the head of my department and General Fruin today about a whole range of different issues. As I said before, there are AstraZeneca appointments available right now. I'm deeply grateful to the 2.6 million... to the millions of Victorians who have received 2.6 million doses. There's almost 1 million double-dosed AstraZeneca. There's been 2.6 million doses administered across the board. I don't think many other states, if any, have achieved that outcome. It is a safe vaccine. It is available today, but you do have to go through a proper, informed consent process. And we will provide at our clinics a clinician for you to talk to. Or you can go and see your GP, whichever is easiest for you. But there are appointments there now. Any additional vaccine, we will take it, whether it's Moderna, Pfizer, we'll take it, absolutely.
It might have been either Minister Foley, maybe you, maybe Professor Sutton. All the days are a blur right now, but very recently someone said that there was...
It's a common phenomenon, that one.
Someone said that there was modelling being conducted in terms of when we'll be able to get to 70% double dose. Has that modelling been completed, and do we have a bit of a rough timetable?
Not that I have been briefed on, but I'm happy to come back to you, and maybe we can have a discussion later in the week about that, and we can give you some of our projections around that. There's a few variables in there, like, for instance, obviously it's harder to get to 70 and 80% if people make appointments and don't turn up. Now, there'll always be small numbers of people who, for unavoidable reasons, can't be there, but I just ask people, go online, make an appointment. There are spots available. Our daughter Grace spent the whole day online, got an appointment, and was vaccinated on Sunday afternoon. Some of her friends didn't, but just about all of them now have been able to get one of those appointments. The system works. It gets a bit overwhelmed at times because of just the sheer demand, but if you stick with it, you'll be able to get an appointment, and then I just ask that you turn up, go through that process, play your part, and be certain that you're protecting yourself, no matter your age, because everyone's vulnerable here. Even healthy young people, as Stephen has said, can become very, very unwell, and you're also protecting others, because you're at much lower risk of contributing to the spread of this thing.
And just on vaccines again, the Victorian Aboriginal Health Services, they said that they've been talking with the state government for about a year regarding mobile vaccination clinics. They say that, Indigenous groups have done an incredible job vaccinating, but to be able to increase their numbers even further, a mobile vaccination clinic would be great.
Yes.
Is this something that...
I have a couple of vaccine meetings every week, and the one that was held yesterday, because it's always held on a Monday, we had a long conversation about mobile vans. We've got, for instance, dental vans that are not doing a lot of work at the moment. Mind you, getting vans is probably the least of our worries, but we've got vans we can use, and making sure we match up the appropriate staff, making sure that we do all the planning work. There's a lot of that work's already happened. You've seen some pop-ups that have occurred in recent times. They're great for the communities they popped up in, but just so anyone who hasn't had one of those, the reason we've done it in some places and not others is you've got to prove the model, make sure that everything works well. And you'll see, whether it be culturally specific groups going to safe places, so whether it be a church on a Sunday afternoon or a mosque or wherever it might be, or industry, actually going into an industrial estate. We've done this with testing. We can do it with vaccines as well. Listen, if I've got to put a van at the end of your street and go door to door asking people, if you've not been vaccinated, it's just at the end of the street here, we'll do it. Like, we'll do whatever we can to get as many jabs in as many arms. This is a shared thing between pharmacy, they're doing a great job. GPs, they're doing a great job. We were supposed to do about a quarter. We're doing half. We're not complaining. We'll do as much as we can and expand. We've got 55 clinics. I don't think we ever thought we'd have 55 clinics. Long way of saying, yes, there will be mobile vans and mobile services, pop-up services as well. I want to thank our Aboriginal controlled health agencies for the work they've done, and First Nations peoples who've come forward and got vaccinated already. We've got a way to go there too.
And how many, a rough time frame essentially on when mobile vans might actually be rolled out?
Let me come back to you.
Are you considering doing that in the Hume Council, which has some of the lowest vaccination rates in Victoria?
Yeah, I think invariably some of those kind of, well, they're not so left field. They're just common sense. If it's worth trying, if it works, then you're obviously better for it. Logic tells you that those types of approaches, whether it's pop-ups, sort of culturally faith-based safe places, trusted environments is probably a better way of putting it. They'll be targeted in the communities where the vaccination rates are lower to try and get those numbers up.
What would you say to frontline healthcare workers that are refusing to get vaccinated?
I would say to anybody who is minded not to get vaccinated that is the wrong choice to make. The evidence is very clear. These vaccines are safe. These vaccines are incredibly effective. These vaccines are safe and they are incredibly effective at avoiding people getting really, really sick. And for that reason, all of us, if we can, unless you've got, I think, very good medical reasons not to get vaccinated, we should all be going and getting the first dose and then getting the second dose. And then before too long, those of us who are vaccinated by that point will have to start the booster process, which I think could start very late this year or early next year.
How far into National Cabinet is the idea of a vaccine passport for everyday life? Is that a discussion you guys are having?
Absolutely. There was some paperwork that was put into National Cabinet on Friday. It was noted. It wasn't a lengthy discussion. We had some other matters that were probably a little bit more pressing, but I'll be having some conversations with the Prime Minister tomorrow on exactly these issues.
Given all the Pfizer...
Sorry, I think Stephen was next.
Premier, you've got a sweet spot number that you're hoping to get to, a sweet spot or a zero for cases. Is
Yep.
there a number that you'd like to keep hospital admissions to? Is there a number that you can tolerate?
Yeah, that's much harder. Look, I think that in health we often talk about avoidable and unavoidable hospital admissions. There will be unavoidable hospital admissions as a result of any COVID strategy you put in place, unless no one ever left the home ever, right? Or if we were 100% vaccinated like a year ago, right? The ones that are the most trouble for all of us are the ones that are avoidable. Avoidable because people didn't make the right choices. Avoidable because someone could have got vaccinated and didn't. Avoidable because, we kind of thought that politics was more important than public health, or being popular was the best way to manage a pandemic. You won't see me making any of those errors. This is a finely balanced thing. And we're going to do everything we can to make sure that no one who could have avoided being hospitalised finishes up in hospital. We've got a part to play in that, but every Victorian has to work with us to achieve that. If we just pass a law, of course we would. If hours spent at press conferences, mattered, we'd have been vaccinated a long time ago. We've all got a part to play. And, this is hard. It's bloody hard for everyone. And I get it that kids are doing it tough. I get it that mental health is a really fragile thing, a challenging thing. I'd like to think we demonstrated to the community by the promises we've made and the decisions we've made that we understand over a long period of time that mental health, that's a broken system and it needs to be fixed, and I'm getting about fixing it. But I just appeal to people, as hard as that is, let's none of us kid ourselves that letting this run when only 35% of people are vaccinated, that'd be easy. That'll be altogether more difficult than what we're facing now, as hard as what we're facing now is. And that's why we've got to see this through. We don't have an option.
So is that part of the discussions you'll be having this afternoon, the number of the sweet spot for cases and then the number of they're subsequently being in hospital? Is that?
They're always linked. They're always linked. But it'll be much more focused on what's the number, if it's not zero, what's the number that you can keep low? If that makes sense. It does. There's no 500, 700,000 here. Well, there is for like 2 or 3 days, and then it just rockets. And that's the nature of Delta. And, you know, it's not the flu. Doesn't work like the flu. It's not something that you can live with 35% of people vaccinated. That comes properly and appropriately as part of the national plan. That comes when we get to 80. And there's no way for us to pretend otherwise. The Doherty have done their work, and we've all adopted it. We've said, okay, fine. There's some other questions about how we implement that and how we make that work, but they didn't come back with 35 or 45 or 50. They said 70 and 80 for a reason, and we pushed them on it. Believe me, National Cabinet pushed them on it, but they are the numbers they've settled on. Some would say that it should be higher. Very few people say it should be lower, if any. We're signed up to the national plan, and we will deliver it faithfully.
Would you be okay with New South Wales essentially going it alone at 80% before the rest of the country ticks over that 80%?
That's not the national plan. National plan is about all of us moving together.
Would you be okay with them doing it?
That's not the national plan. And I sign up to a national plan. My expectation is that everybody does their level best to do what they need to do under that plan. And that's why we're pushing as hard as we can to get as many people vaccinated as possible. And it's why I'll again say, in case anyone didn't hear it before, there are AstraZeneca appointments available right now. Go online, book the appointment, turn up, get the jab, play your part, keep yourself safe, and help us in our race to 80%.
Given that the Pfizer bookings have been taken, where does that leave the plan to get Year 12 students vaccinated?
We'll have more to say about Year 12s. The vast majority of whom, I shouldn't say vast majority, Year 12s, at least a substantial proportion of whom would not be 18, can only get Pfizer. And I'll have more to say about first dose vaccinating our most senior students. That'll be a feature of the discussions tomorrow.
Yesterday, Martin Foley said that not prioritising Year 12s already was an issue of supply. There are only 63,000 Year 12 students in Victoria, but we had 450,000 Pfizer doses.
Yes.
I know it's a lot, but
yes,
still,
it is.
comparatively.
Yeah.
So, do you regret not prioritising them already? Could we have cut 65,000 out of that odd 450?
No, hang on a minute. I think the point the Minister might have been making, and the point I'll make to you again today, is that if we'd had 600 or 700 or 800,000 doses instead of 400 and something, then we would have a whole bunch of people who, they wouldn't necessarily be vaccinated yet, but they would have appointments, and they'd be locked away and they'd be all set to go. They just have to turn up. I'll have more to say tomorrow, and we will do everything we possibly can to get all of our students vaccinated as fast as possible, but certainly with a priority towards our senior students and those who have to sit exams. They're not mutually exclusive, and I'll have some positive news tomorrow, and I'll detail our plan to get our senior students at least their first dose as fast as possible.
So there's more Pfizer coming tomorrow?
Well, there's all manner of different things that we can do, and it's best if I make those announcements tomorrow.
Will an announcement on the AFL Grand Final be made today or in coming days?
Not by me, but
today, maybe?
I'm not certain. You'd need to speak to Gil about his timelines and Martin Bakula about when and if those decisions have been made or will be announced.
The Department of Health told, business leaders in Shepparton in an online forum that the antibody treatment Sotrovimab will be available to Golden Valley Health. Do you have any more information on that?
No, I don't. I've had a couple of discussions with some clinicians who have stepped me through this as not a clinician. They've sort of done it for me slowly. This has some very good evidence. If it's the same, if we're notwithstanding, probably neither you nor I can pronounce it properly. If we're talking about the same one, I think we are. There's some very good evidence that if it's administered quickly, so very early on, it can have really significant benefits. Perhaps, if you want, I'm more than happy to get someone who knows much more about this than I do to sit down with you, and anyone else who wants to talk about the whole therapeutic thing, like from a treatment point of view. because there's been some exciting developments in other parts of the world, and some of them are approved or will be soon approved here. That's the advice I have.
Yeah, do we know if any have been provided to Goldwood Valley Health?
I don't, but I can find out for you. And if you do want that briefing, I'm happy to have somebody who's clinically trained to sit down and say, well, here's why it works, here's what the evidence shows, here's where we're going to get it from, and here's who we might be able to use it with or for.
And just on the thresholds,
Yes.
we had thresholds for a little while last year and we sort of moved away from that. So will we stick to these thresholds once they're set?
Well, last year I would take an issue with the notion of the fact that we didn't stick to thresholds. We had a plan, a roadmap last year, and we hit our targets pretty much exactly as we said we would. Didn't mean that the intervening period was easy, it was incredibly difficult. But the modelling and some of the predictions, some of the assumptions that underpinned our plan last year proved incredibly accurate because the Victorian community proved incredibly resilient. I am so proud to lead this state and so proud to lead a community that, as tough as this is, we find a way to push through because we have to. There is no easy option. If there was, I would choose it. If there was a strategy that came at a much lower cost or no cost, of course we would deploy that strategy. We would do that. Delta's a bit different. This is where we're at, and we've got to vaccinate, and we've got to keep the numbers low. Otherwise, they get really big, really fast. And instead of talking about 1 0, you're talking about many zeros. We don't want that here, because that's when Stephen just can't do the work that he needs to do, because there's too many patients.
Just on business
Confirm
support.
that, tomorrow's plan will have certain restrictions for fully vaccinated people. Will they have, like, you know?
It's too early at 30. So that's the other point too. 35% is great. Terrific that we're at 35%, much better than being at 34 or 33. But the notion that at 35% we can just let all those people go about their business, it is very effective against severe disease, but it does not inoculate you or prevent you from getting it or giving it. So we would just contribute to the spread of cases. That movement would be incredibly challenging. We wouldn't be able to trace that. We wouldn't be able to. It would completely undermine the strategy, or the first order issue of keeping numbers low. We will get to a time, though, to the earlier questions about passports, and the national plan talks about, and it's got a, in brackets, to be determined, because it's not all the work is not finished yet. Some of the stuff I'll be talking to the PM tomorrow about. But at 70%, that's when we can start to have the differential thing where there will be, I think, greater freedoms for those who are double dosed at that point than those who are not. And that's not a gimmicky thing to get people to get vaccinated. It's just the practical reality that if you're double dose vaccinated, you are much less risk when you get to that critical point of 70 and 80 afterwards.
And just on getting double vaccinated, I know
Yes.
I've asked this before, but AstraZeneca, is there any advice to change the length between doses there? I note our numbers at the moment are quite similar to what Sydney was at when Atagi changed that advice.
And I've got no advice to that effect, but if it were to come, then we wouldn't hesitate to make those changes. The really important thing here is, again, just to absolutely emphasise, AstraZeneca is safe, AstraZeneca works, but you just got to go through a process. You've got to have a conversation with your GP or talk to the senior clinician, the nurse vaccinator, the pharmacist or the doctor that we supply at our 55 clinics. They'll talk you through it all, and if it's, you can then make an informed decision. And hopefully that decision is yes, and you play your part and you help us all get to 80.
And just back on schools, is there some concern about disadvantage between some of the more prestigious schools which are organising their own vaccinations now already, as opposed to others who are waiting? And also, is there any thought going to what happens if one of these schools or kids get caught up in exposure sites mid-exams?
Right, it's just two very different issues there. When I talk about vaccinating our senior students, I'm unconcerned about what school they go to. We'll have a plan for government, Catholic and independent schools.
I understand that, but
Right?
I'm just saying
So that's, we'll look after, because
because
from my point of view, they've all got the same need, and we'll get that job done. It may be more challenging in some communities for a range of other reasons, but we'll get that job done. And the whole cohort is the group that we're looking at. What individuals do through GPs and pharmacy, that's a matter for them. The pharmacists, I have a very good relationship with the Pharmacy Guild, and I'd like to think a reasonable relationship with the AMA, but they don't ring me about these things. They work for the Commonwealth Government when it comes to that part of the vaccine program, so they're probably better placed to answer that. In terms of exposure sites, we got through this last year where we had slightly different virus but many more cases. We got through this, we were able to get our Year 12s through. They were not disadvantaged. I had conversations with numerous CEOs of TAFE colleges and vice chancellors of universities, and they assured me that if we could get the kids through, they would take them, and there would be no issue in terms of their kind of academic level and achievement, and these things level out over a period of time. Assessments are a ranking. They're a ranking at any point in time. The special consideration decisions that we've made so that everybody, not an application system, that's separate, but everybody as of right, where are you at? Where would you have been at? That process works across the board. The Deputy Premier and teachers and staff and school communities have done a fantastic job with that. So it's not going to be an easy exam season. It never ever is. There's always issues for one reason or another, but there are ways that we can manage that.
Premier, the Prime Minister's just said that 500,000 Pfizer doses are arriving from Singapore this week. Is that going to be used to vaccinate Year 12 students?
Well, I'm learning about those 500,000 from Singapore. I don't know the status of those. Are they a bring forward? Are they an extra? Are they like Polish ones? That's great news.
Sounds like it.
That's terrific. That's wonderful.
Is that
That's wonderful.
part of the plan to help?
We'll be getting, as agreed on Saturday when I spoke with the PM, we'll be getting 25% or slightly more of those because it's on a pro rata basis, and we'll waste no time getting those into people's arms.
Is that part of your plan so far?
I don't want to be rude, but you've just told me about it, so it was not part of my thinking beforehand because you've just told me about it, and we've been thinking about this for a little while. But that's terrific news. The more vaccine, the better.
Just on business.
But there are Astra appointments, and they're available right now. Please go online and make one of those appointments, and then turn up, like millions of other Victorians have.
Just on business support and your conversation with the Prime Minister tomorrow, New South Wales have a Job Saver scheme in cooperation with the federal government that I think kicked in week 4 of their lockdown. Yes. We're about to be in week 4 of our lockdown. So is that something you'll be asking for Victoria?
There's some discussions going on between the treasurers. I've had some discussions with the PM, and I'm very pleased and our officers have been talking, and I'm very pleased to confirm that it will continue to be a 50-50 partnership between our government and the Commonwealth government. And as we have done a number of times, there'll be some business support announcements made very soon after I announce what's going to happen with rules. And the Treasurer and the Minister for Industry Support will be leading that. And they're working very productively with their Commonwealth counterparts, whether it be at a First Minister level or Treasurer to Treasurer.
And just quickly, you've said a couple of times in the past couple of weeks that you will consider having the Chief Psychiatrist stand up. Is there any progress on those plans?
I think we're doing pretty well with clinicians at the moment. We had an ICU nurse for you yesterday. We had today, we've got Stevens here as a head of ICU. From a medical point of view, we'll get you some further mental health clinicians. Exactly who that will be, I'm not entirely certain, but I don't want anyone to think that the Chief Health Officer and the government don't sit and consider these matters long and hard. We absolutely do. And again, I say with the greatest of respect to every single Victorian for whom mental health and stress and the anxiety of this and more is very real, I say with the greatest of respect, none of us can afford to pretend that opening up at 35% vaccinated would be easier. It will not be easier than this. It will be much, much harder. We understand that there's a lot of pain out there. There's a lot of very difficult circumstances. That's why we've got to stick together, and we've got to keep supporting those services and keep supporting our kids and everyone across the board. That's why we're doing that. If there was a choice that meant there was no anguish at all, there was no stress at all, of course I'd make it. I'd make it in an instant. We'll get some clinicians from the mental health point of view, from that part of the health system. But back to Stephen's point about displacement, if your hospital system is overwhelmed, then it'll be overwhelmed for mental health patients too. Not just for cancer patients and stroke patients and premature babies and COVID patients. It'll be overwhelmed for everyone who needs care. That's why we've just got to work as hard as we can. As tough as this is, I want to thank every Victorian for the part they're playing. I want to thank everyone out there on the front line, whether it be someone taking swabs at a testing clinic, someone doing sort of queue management at and parking management at a drive-through Vax hub, all the way through to nurses and doctors and ambos, contact tracers, and just ordinary mums and dads, kids and families that are at home when they'd much rather be out living their lives. If we had a different way, we would choose it. These are our options. This is the national plan. It will work. And please book your vaccination appointment as soon as possible.
Has your viewpoint on suburb-specific restrictions changed? I know you previously said they weren't an option in the past, but I believe Professor Sutton yesterday said that it was a measure actively on the table. Oh,
look, every day everything is on the table. My view is that the evidence tells us last year they did not work. Particularly, you know, and again, this is something that's real for us. It's real in Sydney and it's real in New Zealand as well. I can confirm from those discussions last night. This will go to the unvaccinated. It often goes to multi-generational large households who are essential workers. You add those three things together, you can pretend you've put a ring around suburbs or local government areas, but if there's people still moving in and out, then the virus is still moving in and out. You know, New South Wales tried that sentinel testing thing. We tried a similar thing last year, but that becomes overwhelmed really quickly because the test information's only relevant if it's contemporary. If it's 3 or 4 days old, then Delta has bolted. Like, you're out to the 5th ring of contacts by then. Doesn't mean you don't do the tracing and try as hard as you can, but it gets really tough at that point. But if for one reason or another people came to a different view and circumstances changed, I can get advice on all manner of things, and when I get it, I follow it.
Just on another matter, if I may.
Sure.
What's happening with the grand final?
I've got no announcements to make about the footy today or any other major events. I was asked about the Grand Prix the other day. Look, we want to have as many major events as possible. We want them to get back to as normal as possible, as fast as possible, but they have to be safe. And I know that finals footy and the grand final is a spiritual thing. It's part of our soul as a city and state, but no football match is worth putting people in hospital. It just isn't. And, you know, this is a global pandemic and we have to make decisions that are based on the very best evidence. I will leave it to others to make announcements about that event and any other major event.
On a non-COVID...
Last year, the AFL Grand Final public holiday was replaced with a thank you day, also a public holiday. Are there plans to do this if the Grand Final...
I think it might be a go and get vaccinated day, maybe.
Will it be a public holiday?
Yes, it's a gazetted public holiday, as we had committed.
And given that means businesses are going to have to open and pay staff overtime, would that mean there'll be extra financial support for businesses, if that is the case?
Business support announcements will be made in the usual way. Very soon after I make announcements tomorrow about the rules and what's possible in this next phase. We were very clear. We've taken this to an election too now, I think, which we've been honoured and privileged to be supported by a majority of Victorians. It's one of thousands of policies we took, and we deliver on our commitments. There is a grand final public holiday. It is a gazetted public holiday, and that won't be changing, not for so long as we're the government. I know some people don't like that day. I think it's a good day for families. What I want is to get all of us vaccinated, get to the other side of this, so that, you know, certainly next year's grand final Friday, we can be at a parade. I think that'd be a fantastic thing. And then go to a packed MCG and hopefully see Essendon win.
Premier, I know it's not your decision. Sorry, Essendon winning was a joke.
Were you supportive of that? Or?
Of Essendon winning?
Yeah.
I'm very supportive of that.
You are? Good. There you go.
Quickly,
see, these things go long enough, you can find a point of agreement. It's terrific.
Real quick, do you support the idea of families of NRL teams being flown into Queensland to quarantine there, but a woman who came to Victoria for her mother's funeral, I think it's a woman, isn't able to get back in?
So hang on.
Do you think it's a double standard that NRL teams and other international sporting teams...
They're not coming here.
No, are being allowed to go to Queensland to quarantine.
Right. Oh, that's a matter for that's a matter for the Queensland government. And I was asked some questions about the WA government. The only quarantine I'm focused on at the moment is making sure hotel quarantine is as rigorous as it can be, and quarantining hundreds and hundreds of Afghanis who have fled an awful set of circumstances, a brutal set of circumstances in their homeland. And I think we are on track to have around 800 people come through from Afghanistan, come through our hotel quarantine system. And I'm working as hard as I can to try and do some more. The Prime Minister wants some extras to come on top of that, and we're trying to get as many more as we can, and maybe another 100, perhaps even more than that. That's my focus for hotel quarantine. Others can speak to you about what their focus is as they see fit.
Just one more question, if that's right. Are masks required on outdoor building sites at the moment?
Let me double check for you the exact wording on that. Might depend whether you were there on your own or with others. Well, you should have it on, I believe.
And are you aware of any big sites where workers have been caught breaking the rules, not wearing face masks?
I don't have a compliance briefing, but I can chase one up. And if you've got, if I get a sense you might have one in mind, Julia. If you have, I'm happy to chase it up for you. Everyone should follow the rules, and they're a pain. No one likes wearing masks at press conferences or anywhere really. It is challenging. But the Burnett research that was produced only a month or 6 weeks ago, like, you know, I'm not a scientist. I don't know whether there are many scientists amongst us, but it makes really compelling reading. Like, it works. Masks work. They're probably the biggest contributing factor to us running this to ground last year, and they continue to play a really important part. As painful and frustrating as they are, they continue to play a part. So I'd encourage everyone to follow the rules and wear them whenever and wherever you can.
Up to 80%?
Yeah, well, when we get to 80%, we'll be able to... What a wonderful debate we'll be able to have about where masks are appropriate, because we've got 80% of people vaccinated. That'll be a great day.
There are serious allegations of domestic violence and assault against the head of an ALP-affiliated union, included in a sworn statement from his wife. He's obviously been previously convicted as well. Do you think John Setka should stand down pending a police investigation?
I think the Victoria Police should investigate that matter and all matters without fear or favour.
What message do you think, though, it sends to victims of domestic violence that he won't stand down, and that also...
Well, that's a member... Hang on. He works for the members of his union. There's a process of investigation. It's for them to answer those questions, not me, Samaya. The message, I hope, that our Royal Commission and the faithful delivery of all of its recommendations, billions and billions of dollars of additional funding, more money than if you add up the domestic violence and family violence funding of every government in this country. If you add it all up, it's less than what we are investing. I hope the message to Victorian women and their children is that we take this matter very seriously, and we are prepared to not just talk about it, but to get on and do something about it. And we've got a long way to go, But anybody who's accused of that sort of behaviour, police should deal with them, and they should deal with them in a fair and proper way. And that usually doesn't involve politicians trying to do that work for them. I'll let police get on with that, and I'd be confident that they will. Any other issues? Thank you, and can I, on your behalf and on behalf of all Victorians, can I thank Stephen and his team for the work they do 24/7. It is the best of work. Thanks very much, everyone.